Hello and welcome. You're watching Yashoda Hospitals, the Health Talk session. Not only are summers in India immensely uncomfortable, but they also have the potential to be lethal. You can actually breeze through summers and keep yourself safe, but the only way to do is by being aware of the illness that summer can trigger. So let's discuss about summer illness and how to keep safe in our today's episode. I'm Dr. Lakshmi, and let's welcome Dr. Venkatesh Billakanti, consultant physician from Yashoda Hospitals, High Tech City. Welcome to the program, Doctor.
Good morning, everybody. I'm Dr. B.V. Rao, General Physician at Yashoda Hospitals, High Tech City.
So to begin with, Doctor, why do you think we all have to be more cautious about our health during summers?
With every season change, generally we see a body acclimatizing to it, and with behavioral changes and internal mechanism which is inbuilt. During summers, it is very important to be hydrated, because this heat and humidity will cause dehydration within our body. So maintaining hydration by taking adequate water, fluids like fruit juices, coconut water is very important. This will also boost our immunity.
So could you brief us about some of the most common summer illness that you see in your clinical practice?
Most commonly during summer seasons, we see patients coming with heat stroke, dehydration related issues. During the peak of summer, viral infections like chickenpox. In kids, we see measles and mumps, and food poisoning is another common thing during summer season we see. Most of the cases of heat stroke and dehydration are seen in elderly people who usually have comorbids like diabetes, hypertension, are taking multiple medications which make them prone to more fluid loss from the body, which will lead to dehydration. So most commonly kids do not take preventive measures when they cough and do not have proper hand hygiene, which can lead to spread of infections fast.
So what are the common symptoms that one should be aware of and should not neglect and see a doctor immediately?
The symptoms mostly depend upon what they are suffering from. Usually heat stroke patients or dehydration, when it is happening, people will have increased thirst. They may produce a little urine, and the color of the urine may be very high colored or dark in color. So people should be looking at these things and start drinking plenty of fluids to rehydrate the body. And symptoms like headache, giddiness, dizziness are indication for heat stroke to happen. So any of these symptoms, we need to hydrate ourselves by taking fluids, juices, especially there are a lot of fruits which have high water content, which usually are consumed during the summer seasons, like melon, watermelons, strawberries. Vegetables like cucumber have high water content, which have to be consumed frequently, and fluids at least 10 to 14 glasses a day have to be taken to keep your body rehydrated. Other conditions like viral infections, which where cough, and in case of chickenpox, they may have blisters on the body, which by contact can spread. So any viral illnesses, if like symptoms like cough and all are noted, isolation has to be done and see that they don't come in contact with other people. Another most important thing is food poisoning, which I've told you. Because of contaminated water or food, infections can spread, and they can present with symptoms like stomach pain, vomitings, giddiness, headache, and fever.
So doctor, are there any particular group of patients who are more prone to summer illness, be it age or any other medical conditions?
If you take it by age, young kids are more prone to dehydration and can develop viral infections fast, like measles and mumps, which I told you, which usually spread by cough, droplets through air spread, and the others are infected. And next is adolescent people or young age people who can develop chickenpox, or also dehydration if they are working out in hot weathers or working under the sun for long hours. And in elderly people as they have comorbid conditions like diabetes and hypertension, are also prone for heat strokes and dehydration, because elders like diabetics who are on certain medications, which itself causes increased water loss through urine, or dryness of the mouth, frequently need to drink water. And if they do not drink adequate water during this season, this can lead to dehydration and heat strokes in them. So most commonly these illnesses are seen in young kids and elderly people who are more prone to dehydration and heat strokes.
So we know it's impossible to stay indoors for everybody during summers to prevent summer heat and other illness. So what are the preventive measures that one can take to prevent these diseases, doctor?
It is difficult to be staying within the four walls of the house all throughout the day, but certain things like behavioral changes, which normally we do when summers start, like wearing light colored clothes, loose fittings, is very important. These are very good heat conductors which can cool your body by allowing air to go in, and also tight clothes if you are wearing during summer season. When you're going out, you prevent the sweat to go out, and when it stays back, these are certain reasons where we can see patients with skin related conditions happening. So wearing light colored clothes, loose fittings is very important. Being hydrated by drinking a lot of fluids or eating fruits or salads which have cucumber and all with high water content is very important. And frequently breaking your time to not stay long in the heat is or a warm condition is very important, where you can take frequent breaks and cool your body by drinking cold water or a lot of fluids.
So doctor, we've discussed about the importance of hydration to prevent summer illness, but is there any role of diet to prevent summer illness as well?
There is no particular diet in specific, but foods with high water content are preferred to be taken during this season. Vegetables like cucumber and spinach and green leafy vegetables have high water content. Coming to fruits, most importantly, we eat more watermelon, melons, strawberries, and vitamin C rich fruits have high water content, which are made of more than 80% water, should be frequently consumed to maintain hydration in the body. So preferably high content water foods to be consumed frequently, and daily a minimum of 2 to 2.5 liters, that is 10 to 12 glasses of water in a day, will help you keep hydrated in summer seasons.
So before ending this episode, doctor, what message you would like to give to our audience out there as far as summer illness and to stay safe is concerned?
During summer seasons, start with basic. First, try to wear light weighted clothes, light colored and loose fitting clothes to prevent heat loss and keep yourself cool. Drink plenty of fluids, as I told you, 10 to 12 glasses of water per day. Hand hygiene, very important to prevent foodborne and waterborne infections. And cough etiquette, very important, as we were following all across the COVID. It has to be continued to prevent viral infections which spread fast during these seasons, and to prevent sun burns and heat strokes. It is better to apply sunscreen lotions with a minimum SPF of 15, which help skin rashes during this season.
So thank you, doctor. It was wonderful having you here on our show today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic summer illness and how to keep yourself safe. Do join us for the next week as well. Until then, take care and stay healthy. Thank you.